Sharing to live stream the webinar. Here we go. Looks like we're live. So I will welcome you all and then hand it over to Chris Richardson, the chair of our Board of Health.
Alrighty, good evening, folks. It is a nice evening out. Looks like spring's finally arrived. For those that don't know me, my name is Chris Richardson. I'm the Commissioner for District Run and currently the chair of our county commission and our county's Board of Health. Tonight we've got three folks on our panel, myself. We also have Mr. Dwayne Smith. He's the county's public health administrator. He's going to present some information once we get going regarding the impacts of COVID-19 on our county over the last 45 days since our first case was registered. And we also have Mr. Sam Elbert. He's our county manager, kind of the quarterback of the effort to respond to COVID, and is also making sure that we're keeping all our county services running for the citizens, even if in a little bit of an altered state right now. After the presentation, we'll be opening up for questions. And I just ask if you have questions on the COVID data, on state orders, on the measures that are taken and being recommended in regard to those practices, that's a question for Dwayne. Sam will take questions on county operations related to the COVID response. And if you have policy questions, like what direction is the county taking in regard to state orders and our local situation, those are kind of the ones that I'll field. But with that, I'll turn it over to Dwayne to kind of provide you an update on where we're at in regard to COVID-19 here in the county.
Thank you, Chris. Good evening, everyone. Dwayne Smith. I started in this role on January 2nd. So I am new to Elbert County. I am very happy to be here in this role and working with a great team of leaders as we tackle this epidemic. So let's get started. Next slide, please, Eileen. So our agenda for this evening, we're going to go over our response and coordination to the COVID-19 epidemic, looking at some of our county efforts. You may be aware that the county declared a county emergency several weeks back. We're going to talk about our weekly stakeholder conversations, the website resources we have available, both ours and the state's, how we're attempting to communicate to folks and be as transparent as we can, and keep people in the know. We'll look at the different phases or the next phases of the Safer at Home order. I'll give an overview of the Elbert County data and try to elucidate what's different between the stay-at-home order and the new Safer at Home order. Next slide, please, Eileen. Every morning, around about 9 o'clock, our leadership team meets via Zoom to discuss how we're going to tackle the day, what has come up in the previous day since our last meeting, and emerging issues, and just trying to be as responsive as we can to mitigating the community spread of the virus. So that team includes myself, Alex Jakubowski, who's our Emergency Operations Director, Sam, our County Manager, Eileen, who's our Deputy County Manager and our PIO, Commissioner Richardson, Sheriff Tim Norton, and our County Attorney Bart Greer. It's been a really great team to work with. We all get along really well. So it's a pleasure to work with everyone. We have these calls or Zoom meetings 6 days a week. We take Sundays off. And as you can imagine, things change very quickly, not only from day to day, but within the day, sometimes 2 and 3 times a day. We are very frequently in a reactive mode. Some of the communications that we get from the state, we don't have a whole lot of heads up on, and we try to do our best to respond to what that means in terms of the downstream effects for Elbert County and our citizens, and also interpreting them to hopefully eliminate any confusion and answer any questions that citizens may have. Next slide, please. Several weeks back, this was, gosh, I'm going to let Sam clarify that later on, but we did declare a county emergency that has the effect of officially a point of demarcation moving forward, so that should there be any federal or state financial aid coming down the pipeline at some later date, we have a document in place that was approved by the Board of Health, Board of County Commissioners, that says this problem was big enough that it was taxing our county resources. We had to shift folks from their traditional roles to respond to the epidemic and everything that we anticipated would be coming. Our stakeholder meetings we hold Monday afternoons. The folks on the call include first responders, fire, EMS, law enforcement. We want to hear how the epidemic is affecting them, everything from EMS runs and do they have enough personal protective equipment to protect their first responders, to law enforcement. What has that meant for everything from general law enforcement things to within the stay-at-home order that just expired. We know that people get cabin fever, and sometimes that can lead to challenges. Our school districts, all our school districts are represented, superintendents and some other folks, so we can hear from them and how the epidemic is impacting their ability to teach our kids. Town officials in Simla and Kiowa and Elizabeth, and of course our county officials. So usually it takes hour and a half, hour and 15 minutes or so that we spend just working through issues and trying to problem solve and just keeping each other abreast of what's going on. At our county website, we have a link on the landing page. You see the website there for resources for businesses and individuals. Some of those link to more comprehensive content from the state. But we want to make sure people have easy access to the information that they need so that they can make the decisions and mitigate their risk during this epidemic. One thing we can do, we're a small county in terms of our staffing levels, but it's very important for us to keep folks in the know. So we try to really emphasize consistent communications with accurate and up-to-date information. Unfortunately, with any issue, whether it's health related or anything else, there's a lot of rumor or innuendo in any community. So we try to make sure people know what's true and what's not. So those communications come in the form of social media through our Facebook and county Facebook and Twitter accounts. There are several Facebook pages through Public Information page and Office of Emergency Management and Health and Human Services. Through print communications, through the weekly newspaper and direct mail. And then I also send a daily email situation update to community leadership. And any residents are welcome to receive that email communication as well. If they would like to, they can connect with me. My contact information will be on the last slide. We've been through several phases already, believe it or not, even though it probably seems longer to some folks, especially in the stay-at-home phase. We're going into our third month, starting tomorrow, of this epidemic and the virus and its resulting impact on the community and the state and the nation as a whole. So We've still got a ways to go, but we are making progress. We want to communicate that progress to you tonight. So moving from our initial response to what we're now moving into the recovery phase or reopening of businesses on a staggered progression, if you will. And later on, when the virus infection rates and hospitalization rates have declined to a point where we can safely maintain it and box it in is a term that we use sometimes, just to, on the way back to some semblance of normalcy. Our responses we've had, our initial responses were challenged by supply chain issues with personal protective equipment. You're most likely familiar with those challenges if you hear from social media or national news outlets or local news outlets. We're also challenged with data collection and tracking the cases. We've made great progress, both locally and as a state. In both those areas, the PPE supply chain is easing up a little bit. We do have, the state has some alternate care facilities that are just about ready to go at the convention center and the ranch on the Larimer County Fairgrounds up in Fort Collins. And again, moving out of the stay-at-home order and getting a little bit of relief into the safer at home phase. Moving into the recovery, again, the safer at home, looking at the economic impact. I think Sam will probably touch on something that is in the works with the local Chamber of Commerce. And how can we best support individuals, not only those impacted in some manner, everybody's impacted in some manner, but some more proportionally impacted, both financially and from a physical and mental health perspective. How can we provide those supports or direct them to the resources that folks need to manage their lives, their finances, their families, their education, their jobs, and so on. And ultimately, we'll make it to a maintenance phase. My job, in a nutshell, is to promote the health and protect the environment of the entirety of Elbert County. And it's a big county, as you all are aware. But ultimately, my main goal is to make sure that we have the opportunity for health promotion and to pursue healthy lives in all its forms. And we recognize that during challenging times, our mental health is a significant component of that pursuit. Next slide, please, Eileen. Okay, so what does the data look like? So here's our county in the L. To date, we have had 30 confirmed cases of COVID-19 infection. And it's important to note that a couple things, that those 30 cases have come since the inception of the testing in mid-March. Those are not 30 active cases. The vast majority of those infections, those cases have run their course, and people are have regained their health. That only represents those individuals who actually had a test for the virus. Early on, when testing kits and testing supplies were in short supply, individuals weren't getting tested, even at hospitals, unless they were either showing symptoms of the virus, being the cough, the aches, the fever, some gastrointestinal challenges, those types of symptoms. Some of them weren't even being tested unless it was going to change the course of their plan of care. Many, if not most, were told to manage the symptoms at home, to isolate, and call their primary care provider And of course, if they had shortness of breath to where it was, life-threatening, to call 911. That's not a great option for folks. And it's unfortunate that we had to, as a healthcare entity, healthcare system, both locally or statewide and nationally, had to implement those types of drastic recommendations. In the absence of the epidemic, most folks would have been admitted to the hospital. Some of them would have been put on ventilators. And obviously, the longer you wait to that critical period when someone's infection has gotten to the point where they are short of breath, again, that's not a great plan of care. So of our 30 cases, you will see predominantly, most of them are in the northwest part of Elbert County, where our population center is, our most dense population, relatively speaking, and then 7 in the southwest part of the county. The vast majority of cases are in the 80107 zip code, which is Greater Elizabeth. That zip code has a little over 12,000 residents in the zip code. We have had 2 cases in the Kiowa area. A couple of those 23 cases in the northwest part of the county are actually Parker addresses, but are within the confines, the geographic boundaries of Elbert County. We haven't had any cases in the central part of our county or in the eastern part or down in the L. So again, how do we mitigate the spread, the community spread of the virus? Social distancing is our best option. Wearing face coverings when we need to go out, staying at home as much as we can, only going out for necessary errands, and just using good common sense and understanding your own tolerance for risk. Of the data, as I'm trying to recall from my calculations yesterday, the average age of those infected of these 30 cases is about 51.5 years old. The median age, meaning half the cases are older, half the cases are younger, is 53 years old. So if you are generally 50 years old or older, you're at a higher risk than a younger population. We have had a few young folks. I want to say maybe our youngest was a teenager. Couple folks in their 20s and 30s and 40s, but again, if you are over the age of 50, as I am, and I think the other gentlemen on the call are, please be especially vigilant with your layers of protection and your protective behaviors as you are out in the community. Next slide, please, Eileen. Okay, this is a great graph, I think, that Commissioner Richardson put together, and it shows you how Elbert County compares to state reported cases in CDERS. That's the Colorado, the statewide disease registry, disease reporting system, I should say. You can see our first case back on March 16th, and we really haven't had a whole lot of cases comparatively speaking. We've had obviously less than 1 case per day, and a little later on, I'll touch on what that means for some other requests we're going to make of the state. So Elbert County is by and large doing a really good job of in the stay-at-home phase, people staying at home, people taking precautions, and really just taking care of their friends and neighbors. This is about everyone. Mitigating the risk and boxing in the virus is really about everyone looking out for one another and protecting the residents and families in our county. So I do appreciate everyone's efforts. Please stay the course. We've still got a while to go, but please continue with these great behaviors that you have thus far been practicing. Next slide, please, Eileen. Okay, moving from the stay-at-home phase to the safer at home. The stay-at-home phase basically was an executive order from Governor Polis that says, just like it sounds, you must stay at home, except for critical daily activities like going to the grocery store or going to the doctor or going to the pharmacy. Safer at home is a strong encouragement to remain staying at home or limiting your travel in the community. I know the governor has said, given guidance on things like, we really don't want people moving or traveling more than 10 miles from their home, or we don't want people to travel outside the county. It's really tough, honestly, to stick to those types of guidance, even though that would be the best thing for everybody. We have to balance the public health issues with our own personal health issues, particularly as it relates to mental health and our behavioral health, and also our physical health. People need to get out and walk and exercise and things like that. So we are putting those decisions in everyone's respective hands and asking folks to just use good common sense when they go out and when they need to go out. There is a phased approach to opening businesses. This past Monday, the 27th, businesses, restaurants and some others could open for curbside service. Tomorrow, retail businesses can open as long as they are adhering to the social distancing measures, putting smart protocols in place, limiting the number of folks in a particular store at one time. Again, it's still subject to no gatherings of more than 10 people. What that may look like in your individual, let's say smaller shops in downtown Elizabeth, as someone's at the register checking out, give that person 6 feet of space. And when their transaction is done in front of you, the business owner or the person behind the register will call you up to the register. And just spacing and again, covering coughs, covering sneezes, keeping, hopefully if you have a bottle of hand sanitizer in your vehicle or in your purse or things like that, using that regularly. And businesses are, will be doing a good job of wiping down common touch surfaces, whether that's a countertop or doorknobs, or I know some businesses like banks are issuing, when someone needs to use a pen, the customer is taking that pen with them and they're replacing that with a new clean pen. So be prepared for a little bit of unusual protocols as you go out. And it's going to take a little bit of time to get used to some of this stuff, just like it takes a little bit of time to get used to seeing people wearing face coverings and some of the other protective practices that we all need to adhere to. Thinking about waiver requests. So when the governor Sunday night issued an executive order, and the Colorado Department of Public Health and Environment, their executive director, Jill Ryan, she issued an accompanying public health order. there are many provisions in the public health order. There is an avenue whereby a community, a nonprofit, a business entity, whomever, can ask for a waiver of relief from specific provisions in the public health order. So what that process looks like, and I'll just use the example of high school graduations because that has been a hot topic, and I've had conversations with every school district the last couple of days on this issue. Our high school seniors and all our kids in school have had their spring taken away from them by the epidemic. So we would like to try to make sure that the graduating seniors have as normal a graduation ceremony and experience as can safely and reasonably be achieved. So for the smaller school districts that might only be, graduating 15 seniors, 20 seniors, or perhaps less, as well as Elizabeth High School that we'll be working with on a waiver for them as well. In consultation with the school leadership and myself, we'll come to a consensus agreement, and if we all agree, I will approve the application for the waiver of the restriction for no more than 10 people meeting in or gathering in the same space. And that recommendation will be sent on to the Board of Health for consideration. And should they approve it at the Board of Health level, it will be sent to CDPHE for review and hopefully approval. Some of the things we'll highlight in the applications are there is natural social distancing that is part of the rural fabric of Elbert County, particularly on the central and eastern sides of the county. We have had statistically and comparatively few confirmed infections of the virus. And some of the other measures that the state would like us to address, we simply can't. They want, for example, larger counties to address the issue of hospitalization rates or a decline in the number of cases. As our cases just trickle in over the course of a week, it would be impossible statistically for us to demonstrate what they're looking for is a 14-day decline in the number of cases. We might have one case this morning and one case on Tuesday and maybe 2 cases last Friday and so on and so forth. So we will definitely put our best foot forward in the hopes that, again, we can make accommodations to honor our graduating seniors in the best ceremony that we can put together as we collaborate with the respective schools. The county is also working on, and I'll let Chris talk a little bit more in depth about this a little bit later, a waiver packet that'll go to CDPHE so that the request will ask us as Elbert County to make the decisions that are most commonsensical for the fabric of our lives in Elbert County. Without some of the more burdensome proof that they're asking for at the state level that are more applicable to metropolitan areas. So it is a continual dance, but we want the ability to look at making decisions through the lens of rural public health. And depending on where you are in the state, whether it's an urban or suburban or rural or frontier community, decisions should be made in the best interests of those that know the community the best. So that packet will be going to CDPHE, I'll I'll let Sam or Chris weigh in on that later, but I want to say in the next couple of days, certainly by early next week, I believe. And gentlemen, correct me if that's wrong. We will continue to track and report the data to keep residents continually abreast of developments, whether that's in the form of an executive order or Elbert County Board of Health discussions. We do have every other Wednesday at noon. We had one yesterday, so 2 weeks hence at noon we live stream our Board of Health meetings. Historically, the Board of Health meetings have only been once a quarter, but obviously in the midst of an epidemic, we need to have more frequent communications and provide more frequent updates to the citizens. Next slide, please, Eileen. So in conclusion, what can everyone do? Everyone has responsibilities at an individual level. You've seen these many times. Wash your hands, cover your cough or your sneeze. The hardest thing to do on this list is avoid touching your face. We all struggle with that, quite frankly, but that's how the virus takes hold. And if you have, for example, the virus on your hands and your hands are near your nose or your eyes or your mouth, that is a common route of ingestion, as is breathing it in. At the relationship level, we want to avoid close contact with others. At a community level, when everyone is social distancing and wearing face coverings, that contributes to the health of everyone. And at a societal level, know what is fact and what may be rumor or innuendo. We've heard some wild tales. We try our best to stay abreast of them and make sure that we quash those that have no foundation in science or fact. If you're not sure, please reach out to me and ask me whether something is factual or not. Next slide, please, Eileen. Real quickly, what does social distancing look like? So we talk about staying 6 feet away, extending your arm from a person near to you. That's a couple feet. Throw another foot in between, and that's about 6 feet between folks, at least their faces. And you'll notice in this picture, both of the males have a face covering on. Next slide. There's my contact information. I am working remotely. I do check my messages. This is my office number. I do check my messages several times a day, so please leave a message. And I'm going to turn it over because I've probably far exceeded my time allotment on tonight's discussion. So I apologize for that, but thanks for listening.
No, thank you, Dwayne, and don't worry about the time. We do want to get to questions, but getting all the information out is really important. Sam, were there any points on that you wanted to amplify or any additional info that you wanted to pass on?
No, not really, Commissioner. And Dwayne, thanks for all that. We did declare our county emergency on the 16th. That was of March. That was the same day that we had 3 verified cases show up in the county. And following the leads of the other counties. So that was the date for that. I think that was one of the questions that was out there. The only other thing is that we are going to be phasing opening of the county offices. We've been getting protective equipment in place and sneeze guards in place for transactions, making sure people have Clorox wipes and face coverings. To not only protect our staff, but also to protect the public as they come in. First phase of this will be, as you know, we've been closed to walk-in traffic. The first phase of that starting next week and staggered by building. So be sure and call the offices that you want to visit. We'll be to take appointments for a week or two. And then after that, we'll be opening to walk-in traffic but still maintaining the social distancing during this safer at home phase. So if you do have business, we have been providing about 99% of all the services that we've been able to provide in the past with our drive-through, our drop boxes, and our workarounds in place, emails and the website. But going forward, it'll be slowly opened back to appointments, and then after that to regular foot traffic with social distancing in place.
Hey, thanks, Sam. And really, I wanted to kind of pile on there. Really, we shouldn't take lightly the fact that the employees and staff of our county continued to provide services almost uninterrupted. There's very few things that services that the county normally provides that have not been through this period in either the same means we always did or some alternate means. We haven't been renting out the fairgrounds. Partially that is to preserve some clean buildings in case we have an infection or an outbreak in the Samuel Elbert building or the main admin building. We have a place to jump to that's clean and we can continue to provide services. We had limited the use of our campground to those that were here working on critical jobs in critical industries. We had some additional utility workers, some other folks that were working in the region that do move regionally from one place to another, and left that open for them. The only other item that we were tracking really was issue of new concealed carry permits. The sheriff was doing renewals by email, and I think this week he's opened up and we're taking new concealed carry permits again. So when you look at the array of county services that can be provided, they were almost wholly uninterrupted through this period. And that wasn't the case in lots of counties that are much larger and actually have bigger staffs and should have had more capability. The first week early on, as the state was reacting to this, we had folks coming down to our county clerk to get marriage licenses from Boulder. So we were open when others weren't. So and I just think a lot of credit goes to Sam and his team and our staff to continue doing that. As we said, the declaration of emergency, March 16th, we got 3 cases that day, all related in the same household. We try to protect the information and should be protecting the information on our individual citizens as much as possible. But that was our biggest day. After that, they trickled in onesies and twosies over the last 45 days. And, I know it seems like a lot more than 45 days, but that's what it's been. If you look back 14 days, we've had 10 cases. Several of those came in. The most recent one, I believe, or the one prior to, the report made it to the state reporting system, and then we became aware of it 11 days after the test was completed. And that's been fairly common. There's been some as long as 3 weeks. So, we've got 10 cases in that last window, and some of those are probably through what would have been an isolation or a directed quarantine phase. So as Dwayne put up the map, you can see where the concentration are. I mean, if you live on the eastern side of I-70, and we have several folks in the county that do, not a large population, they've been completely unaffected. This is a county where pretty much everything east of Kiowa, our population was social distancing before we had a word for that, or before that term was known. That was just the way you live out here. So we've now kind of hit a point as we're getting better clarity on our own county and our own situation, where we can kind of transition from what was maybe saving lives to preserving a quality of life, and looking at that and looking at the impacts of on people's personal finances, everything, our business community. It is leading to some issues in terms of upticks in behavioral and mental health issues. The sheriff's call for service for suicide attempts and domestic violence are up. Again, our numbers are small because it's a small county, but the sheriff and his deputies, our fire chiefs, they all have a pulse of these communities. So we know there's other public health issues that have to be addressed. So when the most recent order came out, the Safer at Home order, as Dwayne mentioned, there's a provision for waiver of, and I don't have it in front of me, but essentially the wording is any or all provisions of these orders, and then it gives some criteria on how to request those waivers. And what we're pursuing as a county is a waiver to the order. I know there's other counties that have stood up and said, we're just not following it. We're opening, it's hard to tell at times from news reports what that really means. But we understand the frustration there. What we're looking at is a waiver of gathering sizes, a waiver of certain measures that have been directed by the state that are based on our understanding of our local situation, and putting in those measures that actually fit our county and the region of the county that we're looking at. If you're looking at this map, you can kind of wonder why, anybody east of those 2 blocks is doing anything differently. And chances are they're not doing that much differently, as we said, other than we've got businesses in Simla, businesses down in Elbert, which probably is captured in the yellow block with 7. But that's very different than perhaps businesses on Singing Hills Road, where we've got quite a few others. So being able to look at the specifics of the situation and address our local situation is very important to us. The other piece of this waiver is it's designed to be somewhat perpetual, that we're hoping for relief from not only to get some relief so we can make local decisions for ourselves, not only under Safer at Home, but follow-on orders. There was quite a bit of confusion and frustration as we transitioned from Safe at Home to Safer at Home. I mean, we knew Safe at Home was ending on a date certain. That was in the order. It could have been extended. There was no indication they were extending it. There was quite a bit of indication that it was going to be replaced, but we didn't know what it would be replaced with until the day it took effect. We saw some drafts, but they were very much presented as drafts. And it was a draft of the executive order that is what the governor puts out, not the public health order that was based on it. So without really knowing what tomorrow brings, it causes quite a bit of confusion. And I think everybody on this panel and probably many of the citizens out there weren't really sure what Monday was going to bring when they went to bed on Sunday night. And submitting in a waiver that lays out a plan that kind of takes us through what we know the state is going to be calling their next step of protect your neighbors, and then near normalcy and to a recovery, allows us to phase what we're doing consistent with what the state's doing, allow the state's communication system to kind of say, hey, this is the new, what's new, but then be able to explain to our citizens what is happening in relation to those. We want to do what's right by our citizens, and we're committed to that. The one piece of that commitment is actually having to work with the state, because when you talk about many of our businesses, they operate under state licensure. Though we know and maybe 100% confident that we know what the right thing for them is, for us to just go on our own and say, business X, you can open with these measures and you're going to be fine, and we know you're going to be fine, we still put them at risk of losing a state licensure and having a business closed down by that. So working this as a waiver from the state that gives us maximum flexibility to really localize our decisions and make sure they make sense for us is kind of the direction that we've been taking. We've got a plan that's prepared. We've got some letters that are prepared. We've talked to our stakeholders. Information I know was put out to fire districts, the towns, we don't want to surprise them the way the state has surprised us, and make sure that we're all in this together to do our best to serve our citizens. So that's kind of the direction we're going. it feels good to stand up and say, we're Elbert County and we're going to do Elbert County, and we don't really need to worry about what the state says. But at the end of the day, that is not the right way to provide the maximum protection for certainly our businesses that have state licensure. So that's kind of where we're at that. I'll open it up for questions. Just really do want to say it's really been an honor to serve through this period. We've had other emergencies in the county of much shorter duration, but as with every other emergency, our citizens have stepped forward. We haven't had that many people ill. We represent a little less than 0.5% of the total population of the state, and the 3 big counties that surround us are about 30% of the population of the state. So we know the focus of effort isn't on Elbert County by the state. That's not where the people are, but that's where our focus is. And again, though we haven't had many people sick, pretty much everybody in this county has shared that pain. So it's kind of time to start working together and towards reopening and a little more normalcy. So with that, if we have any questions, I think we've got some instructions here to, you can hover your mouse over the bottom of the Zoom screen, and there's a method of just kind of raising your hand, or if you want to type a question into for us to answer, we'll take them that way. So anyway, with that, do we have any questions?
Commissioners, I don't see any questions. We've got about 14 attendees right now in our waiting area who've been listening. We also have had earlier a watcher on YouTube Live, but apparently not anymore. But the recording has been on YouTube Live, and it will be, of course, on our YouTube page after we're done this evening for people to watch later on. So I don't see any questions, and I don't see anybody raising their hand just yet. We do have
we do.
Okay. There we go. One brave soul.
Hello, Laura.
Hi, Laura. Go ahead.
I know that obviously our numbers are very low, and it's a little, there may be some cases that we don't know about if people haven't been able to be tested, or, some issues like that. But has there been talk about, and I know we're not even in comparison to some of the larger counties and their number of cases, but has there been talk about potentially putting in a mask requirement for if you go into a store or a building for the county?
It's certainly been encouraged at the state level and encouraged locally. I know I think you're probably talking face coverings versus masks.
Yes.
Yeah. So the current thought, and I know it's evolved over time. A couple of months ago or weeks ago, the guidance was don't wear masks, as they lead people to touch their face more often if you're not used to wearing masks, etc. But when it comes down to it, we truly trust our citizens to be doing the right thing. If you want to wear a face covering, if you feel that's the right thing to do to protect your neighbors, by all means wear them. If we have individual shopkeepers that would be more comfortable in providing that environment for their patrons, then by all means they can adopt a requirement or request for clients that come in to wear them. But for most folks that are driving from one place to another, they're not interacting with others until they actually get into a storefront. So I guess long answer to your question. The short answer was no, we weren't looking at requiring it.
Okay, that makes sense. Thank you.
Yeah. Thanks. If there's, we still have a little bit of time, but we didn't hit on it. part of our success as a county is going to be and is knowing the details of our county. So, I mean, we've asked our fire districts to share with us appropriate medical call for service data. We don't have a hospital, so we can't track our own hospitalizations specifically. There is a self-reporting mechanism, a tracker that you can get to on the state website or through our website if people have symptoms or want to report on what's happening with them. That gives us a little bit of clarity. Nothing will be done with that data other than to merge it with the other information we have about the county to help us make our decisions. And we did not mention or talk to testing specifically. We are engaging with Peak Vista to support testing for our critical workforce as needed. I believe they've indicated that they can handle some public testing. The county has acquired a quantity of test kits and are working through processes on how to best use those, whether they're, are we looking for baseline survey data versus testing those that we feel may be positive. But that piece has been very, it's a work in progress nationwide. What the validity of the tests, the availability of the tests, the turnaround times for labs, and have been kind of a painful growth process. I know you hear a lot on the news about widespread testing, but it doesn't really appear like it's there yet. Testing of people that have clear symptoms is awesome to confirm that you may or may not have it. If you do have COVID, there's no shot to cure it. There's some protocols that can be put in place for treatment, but that's about it at this point. So,
Chris, if I can piggyback on that.
Yeah, please do, because
testing,
as I trail into areas where I don't have the knowledge you do, please do.
Yeah, I just want to share with folks, there was a lot of initial discussion and perhaps a fair amount of excitement on the blood testing, the serology testing. Some communities are attempting to do saliva testing, and all of those are aimed to be a more rapid test for the presence of antibodies. So in other words, when your body has an infection, one of its reactions is to produce an antibody to fight the germ, whether that's a bacteria or a virus. The problem with that, in theory, it sounds almost like a breakthrough. But what the latest science tells us is that the presence of antibodies does not mean you have immunity to the virus. And that's the important thing to remember. So there are no as yet approved and certainly no recommended serology tests that we will be using or the state of Colorado will be using. The science, as I heard one of the physicians in New York say the other day, it's fuzzy math. It's just not an accurate determination of who is less at risk for infection. So I want to, kind of quell any, I guess I should, I was going to say quell any hope. But yeah, we're sticking with the swab testing. That looks like a long Q-tip that's inserted into the nasal cavity. And that tissue sample will be basically put into a test tube, sent to the lab, and analyzed for the presence of the virus. So that is the gold standard at the moment. And even that, has challenges with, it's not 100% accurate, but it's the best testing medium we have right now.
Dwayne, I'm going to interrupt you before we get too far down the road, seeing as we're running up on time. We've got one comment from Chief Kilduff from Rattlesnake, I believe. Chief, forgive me if I've messed that up. It's late.
Oh, you got it right. You got it right.
He's, oh, good. got it right. Thank you. He says, not a question, but wanted to thank the county for the presentation tonight. I applaud the open communication and information given. Thanks for all you were doing. And I just want to echo our thanks to all of our first responders here in Elbert County. All of our fire departments have been working closely with us throughout the whole process, and they have been more than helpful in their response. And so we really appreciate everything that you all are doing as well. We also have a question from I believe it shows up as an anonymous attendee right here, but I got an identical question in my email from Joanne Mahoney, who is on our list. And she asks, is there a time frame for the parks and playgrounds to reopen? And
Okay.
Joanne, I'll say that parks and playgrounds are in the or belong to Elizabeth Parks and Recreation and not the county. And so I would direct you to them for that question. However, there is probably some guidance in the public health order that speaks to parks and playgrounds. And I would suspect, Dwayne, and you can confirm, that they will be closed at least until we move to the next level away from safer at home. And that's towards the end of this month. So Dwayne,
Yeah.
is there anything specific in the public health order that you're aware of, or Chris?
Yeah, I didn't want to step on Dwayne, but I just, having talked with Parks and Rec, I know we just got to draw a bright line between parks and then playground areas. Parks and Rec's parks are open. They encourage people to get out, get in the sunshine, walk, move around. They just don't have the folks to continuously sanitize playground equipment. And I'm pretty sure, I think Elizabeth's in the same mode, and they're actually taking advantage of this time frame to replace some of the aging equipment in some of their playgrounds that had gotten a little bit of old and potentially represented some danger to kids. So they actually have taken out a couple of their playground areas and are prepping to put new equipment in, so it's available when kids can go back to the playgrounds. So, Dwayne, if you had something more different, please.
I was just going to add, I can't put my finger on it in the public health order right now, but we can certainly look into, I was thinking of state parks, and I'm not quite sure if state parks are open yet.
Gotcha.
But we can certainly find an answer to that and put that out on social media.
And I have that question from Joanne in my email. So, but other than that, looks like we don't have any further questions or any hands raised from our attendees. So I think we could probably wrap up.
All righty. I would like to certainly thank everybody that dialed in. I hope this was valuable for you. We are truly committed to getting out good information as quickly as we can so our residents can make the best decisions for themselves and their neighbors. We are all in this together, and truly believe that, given the opportunity and the right information, that we don't have to enforce, because people are going to do what's right. There's one person out there that does need to be recognized. I think Stacy Reinhardt within Dwayne's office has done yeoman's work in following up on every positive case, doing her best to talk to people, get more information about what their situation was, what their experience was. So not only are we sure they're getting any assistance they need, but we've got the information we know we need to make good decisions. So I thank you all for participating, and I'll be quiet. We got 2 minutes.
Any closing comments, Sam or Dwayne?
Oh, thank you all for everything that you're doing. Thank you to our law enforcement, EMS, fire rescue folks out on the front lines that are doing their best to get folks to the hospital where they can hopefully get healthy again. And that's throughout the year, whether that's a motor vehicle crash or anything else that they encounter. That is a tough, tough job. So thanks to all our healthcare workers that may work in healthcare facilities, whether it's a hospital or a skilled nursing facility or wherever. Thank you for keeping people or getting people healthy and saving lives. Thank you so much.
Sam?
Nope, I'm good. Thanks, everybody.
Thank you all. We appreciate it. And we look forward to hopefully doing this again. And we will announce future town halls on the same outlets that we announced these on. So we hope to see you then. Thanks, gentlemen. Have a good evening.